Governor Kemp also giving Augusta University more responsibility to get Georgians back to work. He announced a statewide partnership with AU and the Georgia National Guard. They'll provide testing at strategic locations all over the state. AU's app and testing swabs will make this possible.
Through this partnership, Augusta University will produce testing swabs in the Dental College of Georgia Innovation Lab. By using the same 3D printers that have produced face shields for our healthcare workers, the Innovation Lab will create thousands of swabs per day. This capacity greatly reduces our dependence on visitors, on vendors, and government entities as we boost testing and get Georgians back into the workplace.
The governor says the screening and testing provided by AU should get started by the end of this week. Now, to tell you a little bit more about the little swab that's making a big difference, here's News Channel 6's Ashley Osborne.
The Oral and Maxillofacial Surgery Department at the Dental College of Georgia says they're used to 3D printing things for their procedures, so they took that knowledge and applied it to these, the nasal swabs needed for a COVID-19 test.
And these guys are the ones that put it into action.
OMFS Director Dr. Jeffrey James was quick to give his residents, Dr. Alex Fagan and Kyle Frazier, credit for finding a way to 3D print the nasal swabs needed for a COVID-19 test.
They got together and started, doing what they do, and they produced a little swab. And at the same time, we kind of presented the idea to some of the medical folks.
He says at first there was some skepticism, so they went back to the drawing board.
You see, oh, it's a little plastic swab. That's great. I could not have told you 2 weeks ago how many man hours it would take to design, trial and error, print and misprint and print them too close, so now they're stuck together.
Once they developed an instrument that was just right, microbiologist Dr. Allison McMullen tested the 3D printed swabs to make sure they worked.
There was some testing done where they collected on patients, and we ran those tests in the laboratory and said they were comparable to our previous swabs, so that we were able to validate to say that they did work.
They added these hash marks to further increase the effectiveness.
So that whoever is doing it, whether they're a nurse or a medic or even a layperson, if the entrance of the nose isn't within this hash mark on the shaft, you're not at the target. The hope is that potential for false negative will go down and we'll get more specimen at the correct target so that Alice can run her test and get a good test, basically.
Dr. James says the effort to 3D print nasal swabs was a collaboration with the hospital, the medical college, and the dental college.
This is a moment where we can help, and so that's what the dental college wants to do, is just help and be there for our community and our health colleagues.
Right now they can make a little more than 1,000 of these each day. Soon they're going to crank out 5,000 a day. Reporting in Augusta, Ashley Osborne, WJBF News Channel 6.